Our next speaker is Benedetta Piantella, a pace-setting, innovative artist and designer turned humanitarian technologist. Benedetta Piantella received her bachelor's in fine arts from Tufts and the School of the Museum of Fine Arts in Boston. She is the co-founder of Ground Lab and more recently, the T4D Lab, engineering research and development enterprises focused on building sustainable solutions to humanitarian, social, and environmental challenges. Benedetta Piantella has served in the role of technology architect for the Earth Institute and the Sustainable Engineering Lab at Columbia University. She has also been an influential consultant for the UNICEF Innovation Unit and UNICEF Gold Chain and Logistics Groups. An internationally recognized social entrepreneur, she is focused on open source solutions to real-world problems and through startups has developed and field-tested projects in countries around the world, including Mali, Tanzania, Uganda, and Kenya, in partnership with UNICEF headquarters and its countries' offices, large humanitarian organizations, governments, academia, and research laboratories. She is currently a full-time faculty member at the Interactive Telecommunications Program at New York University, where she leads the physical computing curriculum and teaches technology for developing courses such as Design for UNICEF and the Internet of Things That Actually Matter. At NYU, she also leads research efforts and curricular design for NYU's Ghana campus that will take students and their ideas to the field. It is with a singular pleasure that I introduce Benedetta Piantella, who will speak on engineering and medicine to improve global health.
Hello. Thank you so much for having me. It's a true pleasure to be here, and it's an honor to be included in this year's amazing lineup of speakers. And it's also great to be back on Mount Sinai campus. Last time I was here, I was delivering my baby, so it is great to be here, not in labor. First thing I need to come clean is I'm not an engineer, and I'm actually trained as an artist, as a visual artist. I was building interactive installations. Up until 2004, I was building immersive environments for users. And it was in 2004 that I found myself sleeping on a beach in Unawatuna, Sri Lanka, when the Indian Ocean tsunami hit. And I miraculously survived that experience, and I stayed behind to help organize some of the relief efforts and really participate in the emergency response. And that's when I realized that I could pretty much use the same skills and the same tools that I was applying for art, but actually applying them to real-world problems. And so that's what I've been doing ever since, kind of building solutions for humanitarian challenges. And when I came out of graduate school, I didn't really know where I fit in the world because I didn't have a technical or an engineering background. So I jump-started a couple of startup companies that were specifically focused on research and development and prototyping of humanitarian solutions for social applications. And I've had the blessing of working with a number of partners in the field, starting from governments to large humanitarian organizations, and as well as research partners in academia, down to the private sector and individual researchers. And the majority of the projects that I've worked on have really been some kind of device or tool that needs to collect data from the field and transmit that data instantaneously to some type of database or a resource that organizations could actually monitor and, based on that information, act more timely or intervene in a more informed kind of way. And the very first project that I've ever worked on in development was actually a global health project. I had just started the company, and UNICEF Innovation and the Uganda country office had approached us to build a prototype of a device that would allow community healthcare workers to diagnose in real time severe acute malnutrition and other complications in children, and then it would transmit that data wirelessly instantaneously to a centralized database that they were building, as well as sending it directly to local clinics and the hospitals nearby, as well as the government. The problem that they were trying to address is that a lot of this diagnosis today happens in a paper format, and those documents, those patients' records sit in a clinic for 6 months to a year before somebody digitizes that data or before somebody physically transports that data to government or the intended destinations. So by the time that anybody looks at that data, the data is no longer obsolete, but if we were dealing with an epidemic, by that time, the situation would have escalated dramatically. So we worked on, some type of device that community healthcare workers could use to do this diagnosis in the clinics. They would speak multiple languages back to the family, tell them the diagnosis, and then it would also continue to follow up with the families that they left and returned to their villages, so that it would send them text messages to make sure that they were following whatever was prescribed. And it also, in doing research from New York, we also kind of learned about village health teams, and we realized that the device needed to be extremely portable so that village health teams could take it to remote villages where they were performing their services. And as they left the villages, the device would look for some type of network and upload all the data instantaneously. And I had a really big problem with this project because I didn't understand how I could build something for an environment I knew nothing about. I had no idea what a health clinic in rural Uganda looked like, and I had actually never been to Africa before this project. So I'm a big advocate of user-centered design and working with your users to build solutions rather than building things for them. And so I had a hard time building prototypes, not knowing exactly what situation we were developing for. But in retrospect, this was actually a great experience because early prototyping really helped us not only to showcase to our stakeholders and our partners what it is that they thought they were building to make sure that we were on the same page and that they actually had thought this through properly, but also it allowed us to show up to the field with some kind of physical device that people could actually comment on or break apart or rip apart if we were off tangent. So we built, using design thinking, we built a number of prototypes that we then took to the field and visited health clinics of different ranges. And got a lot of really useful feedback. I think the biggest lesson learned from this process was that anytime you're introducing a new technology or a new solution, you really want to build on existing methods and really kind of mimic the processes that are taking place and not introduce like an added level of complexity. So what we did is we actually monitored how the process of diagnostics was happening, and we reproduced the same exact triaging system onto the device in a way that it would actually make things easier for the community healthcare workers so that they could, instead of having to enter data on a paper form or by typing, they could just answer the majority of those questions with the press of a button. And showing up with a prototype also allowed us to really identify some of the gaps that this device was leaving behind and some of the things that our clients hadn't really thought about. So there's a lot of data collection that happens today on mobile phones. And a lot of the resistance that I personally noticed from community healthcare workers was that collecting data on a mobile device didn't really leave them with a proof of the work that they had done. So there was an attachment to physical paper. So what we decided to implement afterwards was an SMS printer, basically something that they could use whatever mobile data collection tool they had available between our device or phones, collect the data, and then they could retrieve that data at any time they wanted to produce some kind of printed physical record. It also could be used to print out barcodes and create kind of ID on the spot at different clinics. A completely unrelated to health projects that I worked on was working with conservationists in Kenya to build new open source lion tracking collars in order to mediate the conflict between the Maasai herders and the lions that were preying on their cows. And what we built was open source hardware and a tool chain of software that would then take that data and send it to the researchers or send it directly to the Maasai herders in a text message to alert them that the cows were in a danger zone. But what came out of that project is that we realized a lot of clients actually needed to track some kind of movable asset. It could be for health, it could be for any type of application, really. So out of that came this multi-purpose platform to do tracking that was made of devices and software and some kind of GIS mapping tool. And that's actually something that I've used in collaboration with UNICEF to experiment on how to track vaccines all throughout different steps of the cold chain, how to track the temperature and other aspects, as well as investigating right now how to create a more automated system that would actually take care of the inventory of a lot of vaccines and eliminating the human factor and a lot of the errors that are present today. Other problems that I've tackled over the years have been dealing with lack of infrastructure. So, for example, solar systems for clinics, as well as one of the most recent projects has had to do with communal water kiosks and the fact that water resources in unstructural settlements, for example, is extremely unreliable. They rely on kiosks that they have to travel to, and then the attendant is only available a certain amount of hours a day, and they never know when that is. There's no real transparent reinforcement of whatever tariff that the city or the community is enforcing for the payment. And so we decided to kind of try and reinvent this water kiosk idea, leveraging technologies that are available, for example, the concept of prepaid credit, and giving people really access to a source of water 24/7 by removing the need for an attendant. So we worked on something that would be extremely robust and extremely easy to maintain over time, that would also collect all this data so that we could keep track of how much water was available and how much water was being dispensed, so that in an emergency situation, they could actually, in an equitable way, redistribute water to the entire community. And we worked, again, using design principles. We worked on a number of prototypes in different formats and with different tools, and we used it to present it to different stakeholders and just basically prototype the feasibility of such a system. And a lot of what we used were like parts from Home Depot and off-the-shelf components, and with minor additions of some 3D printed parts. And so we decided to kind of, simplify a lot of the process and change the user interface. And a lot of, or pretty much all of the projects that I work on are really team efforts. I work with a lot of different people, and in this case, I've been working with a fantastic mechanical engineer. So there is engineering involved, and there are real engineers involved, who now really want to use their skill sets towards making a difference and get out of the lab, basically. So we built, an early prototype. We demonstrated it. And then we sort of figured out what the next iteration needed to be. And we wanted to kind of build something that was actually going to be field ready. So we redesigned the whole device and simplified it and made it extremely rugged. And we also built a prototype of that, which was not rugged at all. We just wanted to build, something out of Home Depot fencing equipment that could fit in a suitcase, and we could actually take, again, on a plane back to Kenya so that we could field test it in terms of actually do some kind of user testing again and put people in front of a real prototype to get real usable feedback. So we did that, and we went to Matara Valley, which is an instructional settlement in Nairobi that hosts 500,000 people and growing. And we really showcased this project, and we demonstrated it to the community members, to the water scheme manager that's in charge of overseeing all the kiosks. We showed it to the World Bank, to the Water Ministry of Kenya, to the Nairobi Water Sewerage Company, and we really gathered all the feedback from all the different perspectives and decided to kind of involve all those changes in the next iterations. There was a lot that we didn't know about the problem that, all the reports or all the documentation that we had gotten didn't really necessarily address. So being in the field is really kind of the number one thing to do to really assess the problem. So we saw a lot of issues that we were not aware of. We did witness a lot of, attendance not being there. The payment schemes were not really enforced. There was a lot of water wasted. People were showing up with different size containers, so the system needed to be extremely flexible. And we also noticed one really big problem that we were not aware of, which is a lot of illegal tapping. And it wasn't to avoid the payment method. It was because these kiosks were still way too far from people's homes. And so one of the problems that we decided to really start addressing in the next version was, how can we make this system really reliable, really cheap, and much smaller so we can actually bring taps much closer to people's homes? There's a UN guideline on how far a water kiosk should be from communities, but even that, it's way too far from what we actually found out. So we worked on a much smaller version that just kind of came to life. And another problem, while we were showcasing this project, a lot of water organizations came to us to talk about how a lot of the equipment that we ship to developing countries, if we're lucky, breaks within the first 6 months, and then it stays broken indefinitely. And it's because we continue to build these solutions kind of using a top-down approach, and a lot of these solutions are not built sustainably. They're not built thinking about local sourcing materials or the skills that's actually available on site to then address them. So a lot of hand pumps actually break, and a lot of organizations have no idea which hand pumps are working and which ones are not. So they've been looking at these kind of prototypes that we built to see if there's a way to actually monitor these resources in real time and know what needed to be fixed and how much water was being dispensed. So out of some of those prototypes came like a much sleeker and much smaller design, which is like actually an add-on for existing hand pumps. And a lot of innovation, even in health, and a lot of health innovation has come out of kitchen labs, has come out of garages, right? In our case, it's come out of a bathroom. We kind of recreated a lot of the situations. We tested things, in our bathroom in order to make sure that things were working. We actually got, incredible results. So you don't need to have a multi-million-dollar lab in order to get, a solution that can actually work in the field. As you can see, a lot of the projects that I've talked about dealt with some kind of data transmission, and the majority of them dealt with using the cellular network as a preferred choice of network. And it's because in developing countries, it is an infrastructure that's extremely well developed. There are situations that I've come across, though, where there is no cell phone network in certain areas, or the telecommunication companies are really charging a premium for their services. And so I've actually still found cheaper to roll your own cell phone network than use another type of networking technology. So thanks to very cheap radio hardware in the order of a couple $1,000s and free software, you can jumpstart your own cell phone network. And when I first started this research years ago, people thought I was absolutely insane. And my department at NYU were like, "You're doing what?" But there was only a couple of options out there, when now this has actually escalated to the point that there is a lot of different platforms that you can do this on. They're all open source, and there's plenty of field implementations of actual entire villages that are running off of community-managed and grassroots cell phone networks. So I do this kind of stuff at a place at NYU called Interactive Telecommunications Program, which is a 2-year graduate program that really is at the crossroads of art, technology, and design, and people from all sorts of walks of life, many different countries and cultures, and way completely different backgrounds, ranging from poetry to medicine to performing arts, come together and work on projects and have access to all the tools of today. And this is where I came out of. I came out of that program. And this is now where I am full-time faculty at. And it really started with our founder, Red Burns, in '79, interested in giving access to non-technologists all the technologies out there to see if they could learn how to use these tools better, and also eventually if that could empower them to build their own. And that's very much the mission of our department today, 35 years later, except for the fact that now instead of renting out camcorders, you're renting out drones. But a lot of amazing projects have come out of this collaborative environment. One example is, for example, Rapid FTR, which was a project that came out of the Design for UNICEF class, which is a class that we teach in collaboration with the UNICEF Innovation team. And this project was an app that aid workers could use to identify missing children and reunite them with their families during type of displacement like an emergency situation or conflict or a natural disaster. And that's actually a tool that UNICEF has adopted and they're using currently in the field as part of their suite of tools. And one of the classes that I teach at ITP, or one of our foundations, is called physical computing, which I think it's really at the heart of all of this and what's allowed me to learn a lot of these tools and do what I do, and in return, I'm now teaching it to people. Physical computing is a hands-on approach to learning how we as humans communicate with our environment and our world through the use of computers, and how we can not only sense things from our environment, but we can also control things in our environment. The difference between this and a traditional engineering approach is that the human is very central to this. We actually start from the perspective of the human. The user is an integral part of this ecosystem. And I think this is really translated to my way of approaching a lot of these projects. And it was only natural that people at ITP would apply the way we teach them software or hardware towards all sorts of problems, including a lot of health applications. A lot of health projects come out of ITP yearly. Whether they're using existing hardware and just kind of hacking it and building on top of it. Like in this example, this project was actually a collaboration with Sloan Kettering Center, and it's been used in clinical trials where Paul just created an app to build on top of any pedometer that would really allow the monitoring and the rehabilitation process of patients that had undergone bone marrow transplant. And other people have hacked Kinect cameras to assess motion disorders. Doug had collected data about his diabetes for a full year and then visualized that data also together with other data sets. And that kind of information that he was able to take out of the visualization actually helped him lower his diabetes by a full point. And now it's a project that's actually open to people to use. Sam also, from personal perspective, investigated 10 weeks of data about food that he was consuming, that he was purchasing, and in order to recreate a kind of a 2.0 version of a food label that really helped him gain some perspective on a lot of information that the food industry is actually hiding. Eric Rosenthal and Michelle Temple built an assistive microphone that was successfully kickstarted, and it's now in production here in New York. And John has been working a lot on projects to allow people with disabilities to kind of hack their own devices and hack things in order to build much more friendly user interfaces, and runs workshops all over the city. And it's not only at ITP. I mean, these kind of collaborations and this kind of innovation happens everywhere. Again, you don't really need a lab, but design schools have produced great products. And there's just forums online that have allowed amazing collaborations to happen and take place. And it doesn't have to be just in first world countries. Things happen all over the world. There's innovation anywhere. People have built their own dialysis machines, or people have built resuscitators to keep family members alive. It's whatever you have access to. The resources are actually out there to build all of these things. And there's also a network of maker spaces and fab labs and hacker spaces all over the world that really supports this kind of activity. And as I said, the resources are out there. There's pretty much at this point a tutorial on how to build anything, whether it's hardware-based or whether it's building something or this kind of idea of a maker movement. It's really been growing. And Maker Media is at the forefront of this through their magazine, but also through something that if you haven't visited, I highly recommend you go to, which is Maker Fairs. Maker Fairs are these showcases of people, invention, and innovation. They happen all over the world, and every year in September, there's one in New York. So you can see a lot of kind of what the future can bring. And I want to leave you with like an encouragement, like whether you want to try things yourself, you can honestly just build whatever tool you want to build, whether by using, if it's an electronic tool, you can access these open source resources and build some kind of platform so that you can build tools that might be useful for your research, or so you can modify things that might not necessarily fit your purpose. You can also, if you don't want to build hardware from scratch, you can hack existing hardware and build an app for it. There's plenty of instructions and information on how to do that. And if you don't want to do either one, I at least recommend you void a warranty of some sort. You open up one of your devices and learn how to change the screen to your iPhone, or break things and get a better understanding of how your tools work. Especially in health, the tools are they're not black boxes because usually they're white with some kind of blue labeling, but the idea is that you have no idea what's inside and how they work. And 90% of the time is because they don't want you to know that thing actually costs like $5 to build instead of the $10,000 you're paying for. And again, online there's probably an instructable on how to build something very similar to that. So please void of warranty. And if you have access to kind of the next generation, I'm a strong believer that we should continue to foster. There's been a big push in STEM education, but when I was growing up, STEM wasn't even a word, and yet I still had the same curiosity. So I really think that we can help the next generation become the problem solvers of tomorrow by continuing to foster their curiosity in building their own things. This was actually a maker fair, and people played with junk for hours, and they could not get enough. And I'm certainly trying to foster that in my own child. But I strongly believe that the future of engineering, especially for global health or development in general, relies on collaboration and on sharing resources, and kind of a more modern approach. And interdisciplinary teams was discussed, at length in last year's Mount Sinai Innovations. So I strongly believe that is the key. So if you have any kind of crazy idea of problems that you want to present to us or to our students, please feel free to contact me. I'm local, I'm in New York, and I would love to hear from you. Thank you so much.
Your ingenuity is really inspiring, Benedetta. Thank you. So this concludes our session for this morning. I want to encourage you to take in the demos just outside in the West Lobby, and of course come to the breakouts at 1, and then the Trainee and Entrepreneurship Forum at 2. We'll reconvene here tomorrow at 8:30 in the morning. We have more spectacular speakers tomorrow. Thanks all for being here.